Hi there, thank you for joining me today. Gas loss in the IAB circuit is a high-priority pump alarm that you may see on the monitor display during therapy. What does the gas loss in IAB circuit message mean in IABP therapy? And what should you do when you see it? Let's take a closer look. When this alarm appears, the pump will stop pumping. You will see the standby banner displayed on the monitor screen along with the loss of the balloon waveform and augmentation value. To understand why this alarm occurs, let's take a closer look at how helium gas behaves in the IAB circuit. Medical-grade helium is used to inflate and deflate the IAB catheter. Helium is used because it is a very small, low-density gas, which allows it to move quickly and support rapid therapy delivery. This is an illustration of an intact IAB catheter in the descending aorta. Helium is a small gas molecule, so it can move across an intact balloon membrane. This normal and expected process occurs even when the balloon membrane is fully intact and does not result in harm. This video illustrates just that. Notice how the small helium molecules are moving across the balloon membrane. The molecules move because of a process known as diffusion. So what exactly is diffusion? Diffusion is the continuous movement of gas molecules from an area of higher concentration to an area of lower concentration. You can think of this like people moving between two connected rooms. When one room is crowded and the other has more space, people naturally move from the crowded area into the open one. So let's apply diffusion to our IAB catheter. Diffusion is taking place here. The helium molecules are moving from an area of high concentration inside the balloon to an area of low concentration outside the balloon membrane. Even with an intact balloon membrane, helium is continuously diffusing out of the IAB catheter. As a result, the gas pressure within the IAB circuit can gradually decrease, which may trigger the gas loss in IAB circuit alarm. To help manage this expected loss of gas over time, the system performs autofills to compensate for helium diffusion. Autofills maintain the appropriate helium pressure within the IABP system. Autofills occur automatically every 2 hours during therapy and help ensure consistent system performance. If gas loss exceeds what the system can compensate for, the gas loss in IAB circuit message may occur. Because autofills compensate for normal diffusion, a gas loss in IAB circuit alarm indicates that gas loss is greater than expected. This is a high-priority alarm and requires your immediate attention. Whenever you have an alarm, always use the help screen to guide your troubleshooting. Let's walk through how to assess and respond to this alarm. Gas loss can occur for several reasons, including an IAB catheter perforation or a high rate of diffusion due to loose connections or patient condition. While the cause may vary, the key is to quickly assess the IAB catheter and pump to determine the next appropriate action. Let's talk about the first cause, an IAB catheter perforation. This is a potential complication and it requires immediate attention. So first action, check your patient's catheter and tubing for evidence of a perforation. Look for blood, dried blood, or serosanguinous fluid. This image illustrates what a balloon perforation potentially looks like. Remember, helium is a clear gas, so any discoloration in the tubing could indicate a balloon perforation. If you see blood, make sure the pump is placed into standby. Then disconnect the catheter tubing. Clamp the tubing between the white Y fitting and the male connector, and notify the provider. The IAB catheter can no longer be used. If you do not see blood, inspect your connections. A loose connection can allow helium to escape and trigger the alarm. Check all tubing and connections to ensure they are secure. After checking your connections, complete a manual autofill. Press and hold the IAB fill key for 2 seconds to complete this manual fill. Then press start to resume pumping. This is important. If you don't complete the autofill, the alarm will reoccur. Remember, the autofill process purges and refills the IAB circuit with fresh helium. So make sure you press and hold the IAB fill key to complete the autofill. To successfully resolve this alarm, the autofill process must be completed. One more thing, there are 2 clinical conditions that can make helium diffusion happen more rapidly. This includes if your patient is febrile or tachycardic. These 2 conditions cause helium to diffuse more rapidly and may trigger the gas loss in IAB circuit alarm. It is also important to assess the patient, patient-related contributing factors, and the IABP system for any changes that may be contributing. If these conditions apply to your patient, consider initiating a manual fill before the scheduled 2-hour autofill. To do that, remember to press and hold the IAB fill key, then press start to resume therapy. Let's wrap this up. As we learned, Gas loss can occur due to catheter perforation, loose connections, or high rate of diffusion. Now that you know why this alarm occurs, you will know how to troubleshoot it. Hope this helps make you feel more confident in caring for patients with IABP therapy when the gas loss and IAB circuit alarm is activated. Thanks for learning with me today. See you next time. Goodbye.